who should undergo genetic testing. And you guys can read through those. But the first one I want to start off with is the NCCN guideline, an individual from a family with a known BRCA1 or 2 pathogenic or likely pathogenic variant. That's pretty straightforward, and oftentimes you can just go forward with targeted testing with that kind of family history. I want to start with this case, though, which was a 59-year-old female that I saw designated by the arrow who had had DCIS at age 52. When I saw her, she had a maternal half-sister who had tested positive for a BRCA2 variant, as well as a full niece. Those two relatives were related to one another as well, so we discussed very likely that those were the same BRCA2 pathogenic variant, but for completeness sake, we did request a copy of the niece's test report as well. And it did end up being a separate BRCA2 variant that was present in that relative. When we tested my patient, she carried the second one. So while most of the time targeted testing would make sense, I think you need to be cognizant about what other factors could be at play and making sure you're not missing something that could be present there as well. This next case, it was the daughter of a woman who had had breast cancer, first in her 40s and then again in her 60s. Her sister, my patient's sister, had done genetic testing and had found a RAD51C pathogenic variant. While we could have done targeted testing for that known pathogenic variant, that's not really a gene with a good tie to breast cancer per se. So we did do a panel on her. She did come back negative, which was good, but still wanted to have her watched more closely based off of the family history of breast cancer. Women who have been diagnosed with triple-negative breast cancer at or below the age of 60, in general, around 15% of those are going to come back with a BRCA1 or 2 mutation. We've gotten a little bit more liberal in our practices about what age group we do genetic testing, and largely because there are clinical trials going on where that knowledge is relevant to what type of chemotherapy they might consider or what they might qualify for. Another one, an individual at any age with a known likely or pathogenic variant in a cancer susceptibility gene that was found on tumor testing. This one was a little bit surprising to me when it came back because it didn't really matter if it was a breast cancer, pancreatic cancer, if it was lung cancer, but there was a pathogenic BRCA1 variant, still recommended to have that tested germline as well. In general, it is less common to find somatic